I'll call the committee to order and ask the chair to call the roll.
Bryan,
Here.
Parker.
Here.
Barnett, Blackwell, Blunt, DeBar, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Parks, Polk, Tate, Turner Ford, Wiggins. We have a quorum.
It appears we have a quorum present. The first item on the agenda is House Bill 1068. There's a motion title sufficient to pass. I hear over here. And this is a fairly straightforward bill. It simply says that the coroners must report to the State Department of Health the death of any person under the age of 18, and that the medical examiner can promulgate, I said the Board of Health, the medical examiner, and the medical examiner can require that information be sent to their office electronically. The idea is to get more information about deaths and focus on deaths that we need to pay a particular attention to, hence the reporting of deaths of people under age 18. Is there further debate or discussion? Senator Hobson.
Thank you, Mr. Chairman. In light of your discussion at the conclusion of the education meeting concerning commas and other matters, I do note on line 161 that there is a split infinitive that may need to be corrected, that rather to electronically enter, it should say to enter electronically information.
Very good. I'm proud of you. See?
Thank you, Professor.
If you present the gospel, eventually the lost will hear and come find the way, the truth, and the light. So there's a amendment to correct the split infinitive. You ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. And the motion, Senator Blunt.
I have an amendment.
Yes, sir.
We all know the problems that many folks have encountered in the state in getting death certificates in a timely manner from the Department of Health. I met with the Department of Health today, and they've requested, along with the Department of Public Safety, where the state medical examiner is located, that we add on line 220 that the electronic report submitted by the coroner shall also include all associated toxicology reports, as well as the death being reported. I'm told that that is one of the main reasons for the delay, that if you have a death reported and a toxicology report is required, and that report is not received by the Department of Health, they cannot issue the death certificate until that box is checked as if toxicology report was ordered. And so that's a request from the medical examiner's office and the Department of Health for an amendment on line 220. Be happy to yield for any questions.
There are questions or debate? You ready to vote on the amendment? All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. At this point, I assume we need a motion title sufficient to pass strike all. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. We will return to item 1478 at a later meeting. House Bill 1678 is doubly referred to appropriations. It involves the baby boxes, as they were called, that we authorized a couple of years ago. The bill is a very straightforward bill. It simply says that the Department of Health will inspect the boxes before they're installed to make sure, obviously, that they're safe and in proper order, and that the Department of Health shall have an ongoing campaign to let individuals know there are many places where an infant can be left in the custody of a medical official or a law enforcement official, and the individual's anonymous, and they're just to publicize that. And then also, every year, a report of how many children were placed in the baby safety devices, which I think is the technical name. That's what the bill does. Are there questions? Not, the motion occurs, the vote occurs on the motion title sufficient to pass. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. And we'll send that to the Appropriations Committee. We're going to have a hearing today on House Bill 41. We're not going to vote on the bill, but it is a bill that's essentially authorizes some podiatrists to do some additional procedures that they're not currently authorized to do. Senator DeBar, I think there are two people from your district that are here that want to speak to us. Could you introduce them and have
Yeah,
them
thank you,
come
Mr.
up
Chairman.
and proceed
Thank
in
you.
what order they wish?
Yes, sir. Thank you, Mr. Chairman. I've got two people present this afternoon. I've got Greg Havard, who's the CEO of George Regional Health System. And then I've got Dr. Stephen Georgian, who is a podiatrist who practices in Loosedale, both of these individuals have came to myself, Representative Manley Barton, and the other George County delegation regarding this legislation. And if I could have Dr. Georgian, Mr. Chairman, come up to the podium.
Sure.
and-
Why don't the two of you just come up here,
Great.
because you may need to rely on each other to answer questions as they come, and whoever would like to go first can go first, and then I'll just proceed from there. I will tell you again, you have to speak directly into the microphone up there because we have this very fine system. And if you don't speak directly into the microphone, those of us in the room can't hear you. So thank you. And we appreciate y'all coming.
Absolutely. Can you hear me? Okay. First of all, I want to thank you for hearing us out here. I'm thankful to be here, and I am here in support of House Bill number 41. So just to give you a little background on what we're trying to do, as medicine has evolved, so has podiatric training. And just to give you a little background, a podiatrist nowadays, we do 4 years of medical school, and I say medical school because that's exactly what it is. We're in the same integrated classrooms as osteopathic medical schools. We do 4 years of medical school, and then we branch off and do a forefoot and rear foot reconstructive residency. Okay, now during this residency, we're doing general surgery, we do infectious disease, we do all the different scopes of practice that an intern resident would do, no matter what their specialty might be. Throughout our residency, we do forefoot surgeries such as bunions, we fix hammer toes, we do diabetic limb salvage. But a big part of our training nowadays, it's a 3-year, like I said, surgical residency, is reconstructive rear foot ankle surgery. So that goes from anywhere from simple ankle fractures to total ankle replacements to high-level trauma. We handle all those different types of pathologies. And so we're not asking to do something that is beyond our scope of practice. All we're asking for is to do what we're trained to do and qualified to do. Out of the 50 states, this is the last state that will not allow us to do our trained scope of practice. Where I trained at the Cleveland Clinic and then in Pittsburgh, Pennsylvania, we get an ankle fracture come in, we take it. That's what we do. And so it's one of those things, I think it inhibits us and kind of handcuffs us to be able to service the community. I will tell you this, over just the past 3 weeks, I've had several ankle fractures come through the emergency department at the hospital in Loosedale. ED doc gives me a call, open ankle fracture, neurovascularly compromised. I have the training and the skill level, just as other physicians who complete the 3-year residency training with the RRA, and I've got some handouts I'll give you later. As long as it's an RRA accredited institution, you have the training, and once you've completed the residency, you're trained to do ankle fractures. Back to the point, the ED doc gives me a call. He says, "Doc, look, I've got an open ankle fracture. Patient's neurovascularly compromised. All I can do at that point is advise. We have to ship the patient out. No one accepts them in the state and our local areas. We have to ship him across state borders to get taken care of. A patient with an open ankle fracture, that's a medical emergency. It needs to be fixed. It needs to be splinted and ultimately definitive fixation to be performed. That's just one of many instances that we've had. And like I said, it's not something we're trying to ask that's beyond our scope. We would just like to do what we're trained to do.
Do members of the committee have questions? Are you familiar with the laws in other states as far as what is permitted and what is not?
Pretty much.
And where does Mississippi stand as far as you can tell in relation to other states?
We're the most restrictive state at this point, and I will tell you, passing this law here, it would still make us the most restricted state in the country. It would just allow us to be able to do, like I said, what we're trained to do.
Okay, thank you. And if you're welcome to talk to us now and hand out passages or however you'd like to proceed. Oh, I'm sorry. Senator Wiggins has a question.
Yes, sir.
Senator Wiggins, I'm sorry.
Mr. Chairman, I can wait until the other speaker as well, if that's what
Okay.
you prefer.
You come right ahead.
Thank you, Mr. Chairman. My name is Greg Havard. I'm the CEO of Georgia Regional Health System. I appreciate you giving us a little opportunity to come in support of House Bill 41 and maybe answer some questions if you have any. I will tell you, I won't bore you with a bunch of details unless you want me to. I'll certainly do it. But I operate a healthcare system in Southeast Mississippi. We serve 3 counties in the South. And I've been there 9 years, been in healthcare for about 27 years. You know, I actually worked this hospital back in the 90s. And even back then they struggled, you know, just because of a shortage of physicians. You know, there's just a few orthopedic surgeons in the state of Mississippi that, you know, you can't cover every 82 counties. So when I was there, started 9 years ago, we certainly tried to recruit some orthopedic surgeons, and it's just, you know, like everybody else across the state, it's hard to get some of these physicians. There's just not enough of them. So we came up with a solution. If we started looking through these things, we realized there was a solution to some of our issues. And I actually got some information from an orthopedic surgeon that introduced me to board qualified foot and ankle surgeons that came through pediatric medicine. And that's how I know Dr. Georgian is through an orthopedic surgeon helping me recruit someone. So they work together good, but we've struggled over the last 20 years to have sustainable coverage to cover our ER at nighttime, to help the ER physician when he needs help. So we, in our 3 or 4 county, there's not one person there that can perform ankle surgery other than Dr. Georgian. He's willing to do it. He's trained to do it. I've got a list here of all the medical schools that train podiatrists. I think it's about 12 of them. 7 of them are incorporated with osteopathic physicians across the United States. I've got a list I'll give you, and I think this will be eye-opening to you, of all the residencies that they can go to in each state. And as you look through that, you'll notice some prestigious universities that train podiatrists for rear foot and reconstructed rear foot and ankle. You know, the Mayo Clinic, Oster's in New Orleans, you've got Mount Cedars-Sinai, they all train these folks. So you're like me, if you remember podiatry, you know, how it evolved, or even medical schools have evolved over the last 50, 60 years, you'll see that, you know, podiatry has evolved to a credible science. So, and as a CEO, I represent the Rural Hospital Association also, and they put this on their agenda to support across the state. It gives rural hospitals the opportunity to actually serve the community and not, you know, beg other people to help us all the time. We actually have some solutions. So, you know, like Dr. Georgian told you earlier, time after time, we have patients come to the emergency room or just show up in a clinic that have ankle issues, and it puts qualified podiatrists in a position to think, well, I can treat this, but legally I mean, medically I could treat it, but legally in the state of Mississippi, I cannot do it. So it puts them in a bad position. You know, it delays care for patients. He talked to you about the young gentleman that came to the hospital in his 30s, had an ankle fracture, you know, and it was compromised. So after COVID, you know, it's getting harder and harder to transfer anybody to any hospital in the state of Mississippi. You know, it's just getting tough. So this is just one more problem that we all have. So you know, we do support this, and I think we do have a solution. Like Dr. Georgian told you, we're not trying to get. Let me back up. We acknowledge that not all podiatrists can do ankle surgery. We also acknowledge that not all orthopedic surgeons can do ankle surgery. You know, they specialize, but there are a select group that have gone through the training to become board certified through some accredited agencies to prove that they are capable. The bill also has some more safe fails that they have to be approved by the medical staff of the hospital. And they've got quality standards where they, you know, check their case logs, check their national practitioner database for any adverse actions. So there's lots of checks and balances for not just a pediatric surgeon. Any surgeon that comes to our hospital goes to these checks. So it's a rigorous set of rules that we have. So we'd appreciate any consideration you could give to us. And before I leave, I will hand out this list of residencies for you to look at, because I think it will open your eyes, because when I looked at this, I didn't realize there were this many across the United States, and it'll be universities you recognize.
You've handed out to us some information which says state scope of practice information, March 2023. Do you know what the source of that information is, or who compiled the chart?
I think I gave you all of my copies. That comes from the, it's either the CPME or it's the American Academy of Pediatric Medicine. I think it's the Council on Pediatric Medicine that I got that report from. And I updated that for Alabama. Alabama was the last update since 2023, and they're no longer a no under ankle, they're a yes. Thank you.
But it would be fair to say this information comes from a national organization of.
That's right. Yeah, the CPE is the accrediting agency for medical schools and residencies for podiatrists. And this is their form. So like I said, they did not update the Alabama form yet. I updated it for you. Alabama passed their law last year to allow qualified surgeons.
And I think Senator Wiggins has a question for one or both of you. Senator Wiggins.
Thank you, Mr. Chairman. So appreciate y'all coming here. My first question, I guess, is going to go to Dr. Georgian. So I just want to, because I don't fully understand, but I want to explore the training. So you said 4 years, but so for just podiatry in general, it's 4 years of college, and then it's a graduate school program. Am I right in that?
You're correct, medical school, 4 years after undergraduate.
No, my question. Okay, so is it a podiatry school or is it like University of Mississippi Medical School?
So for example, I went to Kent State University. It's the College of Podiatric Medicine.
Right, okay. But it's not, so when you say medical school, it's actually, you're not talking about University of Mississippi Medical School, University of Arkansas Medical School. There's osteopathic schools. You're talking about a podiatric training facility.
Correct, podiatric medical
Okay.
school.
Well, okay, but, all right.
And I'm sorry, I may have not been
But
as
your
clear.
training is not at, well, if it was in Mississippi, your training's not at the University of Mississippi Medical School, is that right?
That is correct.
Okay. And
However, I'm sorry,
Go
I was
ahead.
going to say,
Yeah.
however, 7 of the 11 schools now, for example, like a school in Arizona, it's the Arizona Podiatric Medical School, but they're in the same classes as the Arizona College of Osteopathic Medical students. So it's all integrated together. And that's the reason it's kind of, I know it's a little bit vague, but it is, for example, mine was Kent State University College of Podiatric Medicine.
Okay, so there's only 7 podiatric schools in the country?
There's 11 now.
There's
It's
11,
Very
okay.
competitive.
But there's more medical schools
That
that you
is-
get an MD or an osteopathic degree.
That is correct.
Okay. And so when you and so how long is that program? So if you graduate college and you go to the podiatric school, that is how many years?
It's 4 years of medical school, and then you have to do an additional 3 years of a forefoot and then rear foot reconstructive residency.
No, you keep saying medical school, but we've established that it's not University of Mississippi Medical School. It's a podiatric school. Okay, so 4 years of podiatric school. Okay, and then you do something in foot specialty?
It's a 3-year reconstructive residency after your 4 years of what you're calling podiatric.
And your residency is at a hospital, is that correct?
Yes, sir.
It's how long, 3 years?
It's 3-year
Okay.
residency.
So if you go to the University of Mississippi Medical School or Tulane University Medical School or University of Alabama Medical School, you go 4 years undergraduate, 4 years of medical school, and then you go to residency, correct?
That is correct.
Okay, and then you may want to go into a fellowship, so that's another year of fellowship. So say
Potentially.
surgery,
Potentially. If
potentially.
that's what they're-
Okay, and then you may even want to go even more specialized, like an orthopedic who specializes in shoulder surgery or in foot and ankle surgery. So the medical degree, so that specialty is basically after 4 years of University of Mississippi Medical School, you're going another 8 years before you get to the point where you're a specialist in surgery of your chosen field. Am I correct in that?
I'll reiterate a little bit. So for us, it's 4 years of undergraduate. So for example, for me, I did 4 years at William Carey University. And then after that, just like at UMC or any other medical school, I did 4 years of podiatric medical school at Kent State University, which you do your first 2 years, you do all your biological sciences. We do an extra year actually, or excuse me, an extra semester in the first year of nothing but foot and ankle anatomy. And so that's additional to that. After our 2 years of medical school, then we do boards just like osteopathic and allopathic medicine, except ours is tailored to specifically foot and ankle surgery. And then we do 2 more years, just like osteopathic and allopathic medicine in our branch. So we'll do foot and ankle rotations, whereas they're going to internal medicine or orthopedics or general surgery, they're getting their niche. We know when we're in podiatric medical school that we are going to be doing podiatric medicine. And then after our 4 years has completed, then we do an additional 3-year reconstructive foot and ankle surgery residency. Now, that's just not 3 years like a general surgeon or someone would do their first few years of basic medicine, rotating internal medicine. When we do our 3 years, it's 3 years of nothing but forefoot and rear foot reconstructive surgery, in addition to additional rotations with medicine, with general surgery, with trauma, et cetera. Did that help clear that up a little bit?
Well, for me personally, I understand, but I think what you're saying is it's still 4 years of undergraduate, 4 years of podiatric school, and then 3 years of clinical training.
Surgical.
Okay.
Yeah, surgical training.
I stated my point earlier. So, but it's not through a medical school that we know of in our various states, like Alabama Medical School or Tulane University or University of Mississippi. So my next question is, who in Mississippi, who regulates podiatrists?
It's the Mississippi Podiatric Medical Association.
Okay. Okay. So there's an association on that?
Right.
Okay. Is there not a podiatrist on, I guess it's the medical board?
There is, there's an advisory council to the medical, I think the medical board.
Okay. And so, and I do think it's important about what you presented that all these other states do that or recognize it. But we've been provided the American Medical Association, who is against this bill. What's your comments on that?
I think it's incorrect. I think it's a disservice to the community, and the other 49 states recognize it, and people who are trained to practice, such as myself, and do reconstructive surgery, they're able to do it. Unfortunately, in the state of Mississippi, I can't.
Okay.
Right.
I mean, recognizing that they don't speak for everybody and recognizing there may be differences of opinion, but American Medical Association is the largest physicians association in the country. I mean, you would agree with that, right?
Correct.
Okay. And they're opposed to this. Okay. We've also been handed from the Mississippi Orthopedic Society, were they also opposed this? Okay, they, as I understand it, are the society of all the orthopedists in the state of Mississippi. Am I correct in that?
Correct.
Okay, and y'all work hand in hand with orthopedics, don't you?
Not all the time.
Okay, not all the time?
I mean, occasionally, like, for example, you can get hired on by an orthopedic institution and therefore you're working with them. But most of the time it's not. Most of the time you're either hospital-based, private practice. You can be integrated into an orthopedic facility, but not everyone chooses that path.
Okay, and so we've been provided study information about outcomes that is scientifically verified, that has concluded that showed patients operated on a podiatrist had 84.1% greater odds of suffering a complication than those operated on by a physician or one with an MD or an osteopathic degree. And that the conclusion of the study was that conditions by orthopedic surgeons was associated with lower complication rates when compared with podiatrists. What's your comment on that?
I know that study actually very well. And if you have that study, could you tell me where table 1 is? The demographics?
I don't see that here
Yes,
in a
sir.
table,
That's because
but it
it's,
says a retrospective analysis using a national sample of the Medicare limited data set, so forth and so on, undergoing one of 14 CPT foot and ankle specific codes.
sir, because it's not there. And potentially this study is very biased, and this study, potentially the podiatric surgeons may have been taking care of unhealthy individuals. Who knows? Maybe some of these patients were in the podiatric specialty. They operated on more diabetics with Charcot neuropathy. We know that those patients are going to have a higher rate of complications regardless of the surgeon, regardless. And so that study there, not giving a demographic, diabetes, Charcot arthropathy, neuropathy, it's a little bit of a biased study.
Okay, so, but you would agree that in the scientific community, the studying and the publishing of papers and publishing of research is how the scientific community looks at these things. And so over time, you get what is considered the scientific conclusion of what's going on.
I would disagree.
So the answer is, well, that one study's biased.
Well, the answer would be there needs to be more studies performed in greater detail.
And to George, which seeing you on this side of it, but the fact of the matter is that actually in George County and Lucedale, y'all have had orthopedists working up there, correct?
Never had any of that, but you're right. So in the clinic, they'd come maybe once or twice a week, but none of them would ever cover, it's easy to do it in the daytime, a couple of days a week. Where the rubber meets the road is, are you willing to be there at 6 or 7 o'clock at nighttime when somebody's kid comes in there with an extra fractured ankle? And the answer for the last 20 years has been no.
Well, and I guess we have a lot of different places in the state facing that.
There's a lot of them.
So, as a county hospital, if something happens with malpractice or something, how is that insured?
Same as anybody, same as any other physician. It's all the same.
And it's also, I guess, because it's a county hospital, it's, the damages are capped under the Tort Claims Act.
I think the damages are, but the punitive, can get to the phantom charges where, they trump up the charges and get that. So that's always out there. But yes, $500,000 like any community hospital.
So is it the American Medical Association, the Mississippi Orthopedic Society, and I assume others are all against this bill. And I guess outside of just, well, we're just behind the times, what's your response to that?
I have to be delicate. like I say, if you look at this over 20 years, we've been trying to recruit orthopedic surgeons, these groups you're talking about. And not one time has one of them stepped up and said, I'll come fill the gap for you. And I'll be here in the emergency room tonight when you bring your kid in. So so we've been trying for 20 years. When I was back there in 1990s as a CT tech, we couldn't get them. They would come once, maybe twice a week. And that's not just in George, Greene, Wayne County, and Perry County. That's all your rural areas all across the state. So when you get in urban areas, you've got those specialists. When you start branching out to rural hospitals, we're by ourselves. So, and as it's getting harder to transfer people, we're getting delays of care. And it's not the orthopedic or, orthopedic surgeon's issue. Sometimes the hospitals are just simply full. So you can't get them to them. So then if we can't transfer that patient out of state, then we're left holding the patient that's, in a dire situation, and you've got trained podiatrists that are sitting around that could fix something, but we're not allowing them to. So we did a little study, if you look across, like before Alabama passed their law, you'll watch podiatrists in Louisiana start congregating around Baton Rouge and a little south there where the populated areas are. And what they're doing is getting those ankle surgeries, ankle cases coming across to their day clinics. But even they won't cover your ERs or help you, your fellow physicians. Same thing in Tennessee. They're kind of lining up across there to pull that population across. It's just a matter of a couple of years before Alabama will do the same thing. But what you're gonna do is still leave your rural hospitals out there holding the bag with a patient in the hospital that nobody wants to take care of. And we'll try to transfer them at nighttime and the hospital's just full. So they never even get to call the orthopedic surgeon to say, hey, we've got this patient for you, because the hospital's full at some of the big tertiary centers. So we've tried to recruit for years. It's the same story all across these rural hospitals you go to. I will comment on the
So
AMA.
is it about providing the highest professional care, or is it about just providing somebody so billing can be done to collect on that?
No, you want the highest care. There was a study, a testimony before the Congress from orthopedic surgeons, and I've got the letter here, that acknowledged that let me back up. So in the state of Mississippi, a podiatrist can do ankle surgery if you're in a VA hospital. So if you're down at Biloxi, this fellow could walk in there and do ankle surgery. But we won't let him walk across the street and do ankle surgery at a community hospital. So you got that care. So testimony before Congress from the Foot and Ankle Society, American Orthopedic Foot and Ankle Society, actually praises the orthopedic pediatric surgeons and asked for them to recruit more of them into the VA. There was a study done, I think it was 2015 or 16 is the last one I have, where there were about 5,200 ankle procedures performed in the military, and 4,900 of them were done by pediatric surgeons. So that shows you the podiatrists are recruiting these people because they can't fill the gap for surgeons too, and they've had great outcomes. William Maloney, MD, orthopedic, attest to that before Congress. I've got his letter I'll give to you. But I think it comes down to, maybe people are just, it's hard to change. This way it's always been, and that ain't always right. So we're not trying to replace orthopedic surgeons or any other physician. We're just trying to get competent surgeons in here to handle this.
I agree, and I certainly agree it's hard that people don't want to change. But I think as the Public Health Committee, we have a duty to look out for the public health of our citizens. I mean, that's why we're the Public Health Committee. And understanding what our citizens are dealing with is what we need to know. And so my last question to that is, when a patient comes in with such of a thing, do they know, like, do they go, I want a podiatrist, or do they know the difference between somebody who's been to University of Mississippi Medical School and somebody who's been to the podiatry school?
No, they wouldn't know the difference if you went to University of Mississippi Medical Center or Yale University.
Right. They just want their ankle fixed.
That's right.
Okay. So it's not going to be the patients who get to dictate that, because they don't really know the difference between a medical, like an MD, let's say, and somebody who has a podiatry or, a psychologist or whatever. I mean, there's different levels of training, and the patients, generally speaking, don't know. They just want their foot fixed.
I agree with you.
So there's a certain level of having to look at these things. Okay, so on that, when the patient comes in as the hospital, do you say, you know what? We're going to have you see a podiatrist?
Senator Wiggins.
This is
you
my last question.
promised us
I did.
several questions ago that it was the last question.
I think my point, I will, thank you, Mr. Chairman, for reminding me. I will conclude with that. And I do thank y'all for doing that. I just think it's important that we understand what the training is that we're dealing with.
Senator Parker.
Thank you, Mr. Chairman. This question is for Dr. Georgian. So I don't want to turn this hearing into something that we know it can all get turned into. And so I just want to go into one little question about, there was a lot of inference or reference to studies and how studies are performed and how a study is deemed to be accurate if it is passed by one group or another. I'm going to bring a study to your attention and just see if I can get your comment on it. This one is subtitled, Why Most Published Research Findings Are False. And within this study, there's reference to an acronym I'm going to use, positive predictive value. I sit on the American Board of Optometry board, and I sit on a board for the American Optometric Association. So one of my jobs and roles in that capacity is to look at studies and to analyze those studies and to look at the predictive value and see if that study is really something we should, apply, within our field. And in this study that I'm reading right here, it says that due to a certain phenomenon involving multiple hypothesis testing, that a number of studies that are published in journals are actually not reliable and in some cases are actually false. And it gives these 6 reasons for those conclusions. It says the smaller the sample size of the study, the lower the PPV. Fields with lower effective sizes can lower the positive predictive value of the study. Previous probability of a true finding influences the PPV of the study. Increased flexibility in the study design, endpoints, and analysis affords more opportunities for bias and false results. The greater the financial and other external influences, the greater the bias and lower the PPV. And there is a paradoxical relationship between the number of independent investigators on a topic and the PPV for a given study in that field. The hotter the field, the more spurious the science. This article that I'm referencing here is a published study from the American Medical Association Journal of Ethics. And I just bring this to attention to say that there was a lot of inference or a lot of suggestion made about a study, which we do not have in the complete form here by your reference to the absence of table 1 from the study, which does not allow me to look at the study size or the PPV or the predictive factors of the study. And I'm just going to finish this with a question of, would you agree that without all of the information that I mentioned in the study, to use a study out of context to make a decision on any issue would be a poor reference pool in evaluating the need for a service or any issue regarding that? Would you agree with me?
Absolutely.
I know that was a long question, but I wanted to just bring that to the attention of the committee, is that, and I welcome seeing any and all information that is verified and that I have the full ability to analyze. And everybody in this room will tell you that I don't mind analyzing just about anything that you put in front of me. But I did want to bring that to the attention of the committee, and that is my only question. So,
Senator Blackwell.
Thank you, Mr. Chairman. I just have one question. I think you got a great bill here. I've authored it on our side for a couple of years. And so if the chairman decides to bring it out, you'll certainly have my vote. But I do want to ask a question. In this, you talk about the licensed podiatrist may perform ankle surgery only in an accredited hospital. How about ambulatory surgery centers?
I'm sorry, what was that?
In your,
Accredited
in the
hospital?
bill, yeah, you have, you may perform the ankle surgery only in an accredited hospital. I'm just mentioning ambulatory surgery centers. I would imagine you would want to be able to perform the surgeries there as well.
We thought that was important as we talked to a lot of the constituents and the concerned parties. That gives you an extra layer of, and I know you're familiar with how the credentialing and privileging works. It just seemed to give an extra layer of reassurance to the, like Mr. Wiggins' question about quality. It seemed to just give that extra layer, hey, we've got an extra set of medical staff, under quality metrics, which I know the ambulatory surgery centers have them too, but you've got a set of medical doctors, DOs looking through this
Right.
stuff. That's kind of what we thought would be just another, a way to assure quality and help ease some questions.
All right, thank you.
We have more witnesses. We have time for one more question, and then we'll need to hear from another witness. Senator Hickman.
Thank you, Mr. Chairman, and thank you guys for being here. I don't really know who to address this to, but in Senator Wiggins' questions, and goes to Senator Parker as well, we talked a lot about a study that for whatever the information is, that's not important. My question is, are there any studies that contradict that or any data that you have that contradict the result of the study that we've been talking about?
I do not know of any to date. I think there needs to be a lot more research on that if you're going to take a study and do a comparative analysis. I think research is fantastic, but I think sometimes it can be a little bit misleading.
Thank you.
Thank you, Senator DeBar.
I just ask one quick question.
Yes.
It's a yes or no question. This is for Greg. Greg, you run this hospital for 9 years now. Dr. Georgie and his background. You have to take considerations into patient care, patient safety, revenue, liability, and things of that such. Do you have any qualms in your mind whatsoever of allowing someone like Dr. Georgian and his training to perform surgeries at your hospital in George County?
None whatsoever.
Okay.
I'd take my kids to him.
Okay, thank you. Thank you, Mr. Chairman.
Thank you, and thank you all for coming. If you'll hang around, we may have some more questions toward the end of the meeting. Dr. Jamie Bora of Mississippi Sports Medicine has been nice enough to take time off to come visit with us. Dr. Bora, if you just come up here and tell us about yourself and tell us what you think we need to know about this proposed legislation. And of course, as usual, speak into the microphone. I'll just say briefly that podiatrists in Mississippi are licensed and regulated by the State Board of Medical Licensure. There's an advisory group of podiatrists, but they're completely advisory, but it's the Board of Medical Licensure that regulates the practice. Dr. Burrow, thank you.
Thank you all for having me today. Just to introduce myself and give you a frame of reference where I come from. I'm a orthopedic surgeon who subspecializes in foot and ankle problems. So like Senator Wiggins was mentioning, go to medical school, then do a orthopedic surgery residency, which is 5 years of training, and then an extra year of subspecialty training in foot and ankle problems. Is kind of where my training is from. I attended University of Mississippi Medical Center, and I'm a native of Mississippi. So I grew up here and so lived here and had a father who was a physician here also. And first, I want to say I'm not opposed to podiatrists and what podiatrists do for the state, for the citizens of Mississippi. They're a very important part of the medical community, and they are very needed in the state of Mississippi. So we need them to be here. We need them doing what they're doing because In my opinion, their most important role is preventative care and maintenance care of people with diabetes in order to keep them out of my office and keep them from having problems that lead to amputations and things like that. So to me, their role is more important as a maintenance and as a preventative measures with diabetic foot care and routine foot care and inserts and shoe modifications and things like that. They're very important for that. And that's very important to for them to be a part of the medical community with regards to that. Couple of things we have as far as concerns with the bill itself. Couple of things Dr. Georgian mentioned is they just want to work on ankles. And that's what they were trained to do. Well, again, they have done a residency, at least some of them. Some of the podiatrists that came out before the younger podiatrists did not do 3 years of residency. That in the past, they either didn't have to do residency or they would do 1 year or 2 year. It's just recently in the last 10 or 15 years that they've started doing 2 or 3 years of residency. So we have a significant number of podiatrists in the state that may have not done a residency at all. Some of that is discussed in the bill requiring 3 years of residency. But one of two other big things we're concerned about is the certification with the RRA, means the rear foot and ankle reconstructive residency, is the only requirement to become board qualified is what they use for podiatrists, is 50 procedures as part of that. So, and it's on a list of procedures, and some of which are still foot surgeries, even though they may be allowed to do ankle surgery when they go out. So they could potentially do a residency program, do no ankle surgery, but then still be RRA certified to do ankle surgery when they come out. And my understanding, they become eligible, or we use the term board eligible or board qualified for podiatrists. And then they have 7 years to then become board certified. And this bill will allow board eligible or board qualified podiatrists to do ankle surgery. Now, the other big concern is that, and biggest concern for me is that it hinges their ability to have privileges off of a committee called CPME, which is the CPME 320. Y'all don't have a copy of that. I have a copy of that with me. And that document is put out by 11 podiatrists that sit on a board, I guess, like this in Maryland, and none of which practice in the state of Mississippi. They're scattered throughout the country. And they basically write this document that determines what are podiatric procedures. Currently on that document is tibial osteotomies, ankle replacements, very high level procedures that potentially even go all the way up to the knee. So there's multiple concerns when it comes to essentially the Public Health Committee handing this committee in Maryland the ability to determine what the podiatrists in Mississippi are allowed to do. And right now the bill is written so that it's totally up to them on what they get to do and what they don't get to do. Not up to the physicians or the leadership in the state of Mississippi to make those decisions. Now, with regard to some of the studies that you mentioned, I do believe if you flip the page over, table 1 is on the backside of the paperwork that you may have. And they do discuss some of the conditions that are the differences between some of the patient populations and the numbers. If I read it correctly, the physician operated patients is in the 400s and the podiatrist is in the 110s. So it is less. The only difference in the patient population was there were more patients with peripheral vascular disease in the podiatry group. And that does potentially have some increase in complication rate. But the numbers are up right there for you. Now, as to your question regarding additional studies showing that the outcomes are equivalent with podiatrists or orthopedic surgeons, I also don't know of any that show that, but I do know of some other ones that have been published, at least 2 that have been published, one looking at ankle replacements and arthrodesis, which is fusions of the ankle joint. And the cost of stay, the cost of the surgery, the length of stay, and the complication rate was higher with podiatrists. And another study looking at ankle fractures, since we're talking about potentially giving them ankle privileges, and maybe beyond if you allow this document to be the decision maker regarding their privileges, then they had an increased incidence of complications with ankle fractures with podiatrists compared to orthopedic surgeons. The podiatrists, the complication rate went up the more complicated the surgery was, the more complicated the fracture pattern. So just to me shows there's a difference in the training, and we talked about that earlier. Orthopedic surgeons are trained in foot and ankle orthopedics. They're trained in spine, we're trained in shoulder, we're trained in hip and knee replacements. We're trained in all these different modalities, which the podiatrist would say, well, all we do is work on ankles, but working on shoulders gives me tools that I can use in foot and ankle problems that might not be the traditional treatment. Or if something doesn't work when we're in the middle of surgery and what you normally do doesn't work and you've never seen what to do when that doesn't work, then you don't know what to do. You have to figure it out on the fly, and you're in there operating on a patient. You got to know alternative ways to do something that aren't the standard. Or if the initial procedure isn't working, what do you do to be able to fix that problem? And having that experience to have operated in multiple different avenues gives you the ability to cross-reference and be able to troubleshoot in the middle of surgery when we're trying to take care of complicated problems. The other point I want to emphasize is foot and ankle problems are complicated, and there's a reason why we have trouble having foot and ankle surgeons coming. One is reimbursement. So if anything you need to work on is getting reimbursement increased for foot and ankle procedures. And that would help get more foot and ankle orthopedic surgeons. And 2, they're complicated. So you just have to know taking care of ankle problems particularly is very complicated. And there's a lot interconnected between the foot up to the knee. And if you don't have that cross training, then you're going to have a harder time taking care of things that are complicated, and foot and ankle problems are complicated. So I just want to leave y'all with that.
Thank you. I understood you to mention 3 particular procedures. One was ankle replacement. And if I understood, you were saying there were studies that showed um, uh, less desirable outcomes with those three procedures in particular, but the only one I could write down quickly enough was ankle replacement. Do you know what I'm talking about? And do you know what the other two procedures were?
Yeah, so one, I can get y'all copies of these studies if you want, so you can read the details on them. But the first one I mentioned was in our Journal of Bone and Joint Surgery, which is sort of the highest end. You can rarely get these in publication without good data. It was published in 2019, and it was particularly on ankle arthrodesis inpatient and total ankle arthroplasty, so ankle replacements. The other study that I mentioned, sorry,
Okay,
was
but being
separate.
a layperson, if I just say ankle replacement, that's
What's that?
being a layperson, if I just say ankle replacement, is that a synonym for those two procedures?
Ankle replacement is the same as arthroplasty. That's a replacement. And arthrodesis means we fuse the joints together. So we're actually making the joints fuse together. The bones fuse together, excuse me.
Okay.
They're both ankle surgeries though.
And then were you going to mention other studies or just that one?
The other one was for ankle fractures. Again, that's a separate one.
We've heard that, and there's a chart from a national an organization, a national organization of podiatrists, which says Mississippi is the only state that does not permit this. Do you happen to know if that's accurate, or do you have a different viewer perspective on that?
Yeah, I was under the impression that Massachusetts was another one that did not, but I may be mistaken on that. But I know Alabama did allow it last year. One of the major comments on the study that was mentioned earlier, one of the conclusions is the increased incidence of complications was helpful for making decisions regarding public policy. And I would assume that's implying on adding scope of practice for podiatrists to include the ankle. Right now, the way the bill is written, they can go all the way up to the knee for surgery. So it's not just the ankle right now, the way the bill is written. So I think you have to take that into account.
And the provision of the bill that allows that is?
Because the privileges are determined based off of this CPME 320 document.
Okay, so this document includes procedures that would go
all the way to the knee.
All the way, okay.
Yes, and so regarding Mississippi, I think that's correct in that we're one of the last. Hopefully we will continue to be on the list of ones that don't allow them to work at the ankle. One, because I think it's the best thing for the citizens of Mississippi to not accept increased complications and inferior training and inferior management. They have their board and their overseeing entities are not the same as any other medical specialty in all of medicine. So, whereas we have to be ACGME certified, it's all separate. So also, I think podiatrists serve a very important role right now. They are the ones that keep the people with diabetes from having worse complications because they're managing them and trying to keep them from getting ulcers and things that cause amputations. So the more podiatrists that we have doing that and not doing ankle surgery, the less problems we're going to have for people with diabetes that are going to be developing ulcers and other things because the care is now going to be transitioned to a higher level of care while they're working on ankles and rear foot and all that. And they're going to no longer be willing to take care of the patients that need routine foot care anymore.
Okay. Do members of the committee have questions? Senator Turner Ford.
Thank you, Mr. Chairman. And you may have answered my question with your last few statements. I don't know how exhaustive this list is.
Uh-huh.
Are there any procedures on the list that you believe podiatrists could perform? The CPME?
Yeah,
list?
right now podiatrists can do foot surgery in Mississippi. They can do surgery. So it's not that they aren't allowed to do surgery. They're just not allowed to do ankle and above.
And so,
So yes, I think they serve a very important role in being able to, the limited surgeries that they're allowed to do now.
and how many would you say at this point that they can perform? Is there a rough number? Or-
Yeah, I could probably just guess. I would say probably in the order of 50 plus.
And about how many are on the list? How many procedures are on the list?
I don't know. I've not actually counted them.
And I'm not trying to be difficult. I guess my question is, you mentioned that the list that's referred to in the bill, I guess, covers too many procedures? Is that?
So the list in this allows them to work above the ankle. So it does not limit them to the ankle.
And so how is it possible that the State Board of Podiatric Medicine here in the state of Mississippi could look at the list and revise it to include procedures that you would find acceptable?
Right now, the bill states that it's determined off of this one document, right?
Right, but I guess my question is, let's just say, for instance, this bill could be amended. Is there a way that surgical procedures that you would find acceptable could be provided?
I'm sure there is. I don't know how the processes between the legal processes behind that, but right now, as it's written, it's purely up to this committee to determine that.
But if some other body could determine the procedures and you, as I guess, as well as your colleagues would have an opportunity to review it, it could be acceptable.
Yeah, my hope is we won't get to that point, but because right now other states are dealing now with, they allowed ankles and now they're dealing with trying to keep them from doing knee replacements. And so it just moved up the list. So the question is, if we allow the ankles, then where do we stop? Do we just keep going?
Thank you.
Senator Parker.
Thank you, Doctor, for being here. I know you're in a, challenging position. These are your colleagues that you're referencing, in this situation. Just one question. You made a lot of inference to our need in the state for podiatrists and their important role in foot care and that kind of thing. When we're the only state that is not allowing certain privileges, would it surprise you that someone who's graduating from podiatry school might choose not to come to Mississippi because we're number 50 and might choose to go to another state? Would you find that surprising?
Sure, I would think that would come into their decision tree when they're trying to decide where to go. That's the only reason I brought up the reimbursement. So if you increase the reimbursement for the forefoot procedures, then that'll fix that problem. Then they'll get paid to do what they're doing now and get paid more. And then we don't have to bribe them to bring more in by allowing ankles.
I would disagree. I think as you're leaving school, if you've gone through a challenging curriculum to, learn procedures, that your decision is not going to be based on looking at the reimbursement rate for the procedure. I think it would be the ability to, do the things. I mean, in your situation, if tomorrow someone told you that you could only, do half of what you're doing, it would probably affect, your decision-making on where you're practicing. Say the hospital changed that. So I just, in this situation, just want to just bring that point that, when we are, and I didn't know this until today, if we are the only state that, is in this situation, I do think that with our provider shortages and other things that we experience across, all levels of medicine, that's part of the process we need to look to. And so I do appreciate you talking to Senator Turner Ford about, the list, and, maybe there is some middle ground. As I read the bill, it seems to state ankle, and then it states, the, additional, supporting structures or something to that effect. But someone like yourself, I think you could maybe, get this where it was just strictly ankle and get rid of your concerns in this. But I do appreciate you coming today and appreciate what you do for our state.
Yeah, so the question comes, where do you stop? That's the challenging. Or is how high do you go from the ankle? So,
back to Senator Turner Ford's question then, are we right now, we shouldn't move with our podiatrist any further? Is that your position? We should, there's no middle ground. It's just this, we stop here or
I think that's the best thing for Mississippians is not to accept lower level of care just because we need more people. But so yes, that would be my recommendation would be to leave it alone. But I would definitely, and that's out of my hands,
right.
But I would definitely not hinge it on this one document that allows basically the people in other states to determine what they can and can't do.
So would you or any of your colleagues be willing then to travel to the hospital in George County on an emergency basis when needed, when called by the other doctor, and provide that surgery at the time of need in that capacity?
Yeah, I'll be happy to give the hospital my cell phone number and they can call me anytime.
To travel down there on
Or I can get the patient transferred up here. There are foot and ankle orthopedic surgeons in Hattiesburg. There are two of them that are foot and ankle trained.
Right.
In Hattiesburg. There's orthopedic surgeons in Bienville. There's 2 groups in Hattiesburg. There are level 1 trauma center in Hattiesburg, and there's level 1 trauma center in Mobile, which is right next to George County.
Yeah, I'm very familiar with that. I just know that, sometimes, our patients in the greatest need are sometimes the ones who are the least able to travel and the least willing to travel, and that's a concern I continue to have is that, we have these problems in the Delta and we have other problems that we're trying to find solutions to, and I think part of the solution is having providers in the location where the care needs to be delivered, because I just have not found in what I've been working on an easy way to get providers all across the state. But I do appreciate you being here.
Senator DeBar.
Thank you, Mr. Chairman. Thank you, Doctor, for being here. I appreciate what you do, and appreciate you coming before the committee and testifying today. You heard testimony earlier that this bill, currently Mississippi has one of the most restrictive laws in place for podiatric medicine. Is that correct? Do you believe that true today, as we sit today?
Yeah, as far as I
Okay,
understand.
and we, even with this bill were to pass, it would still remain the most restrictive in the nation.
I disagree with that
Okay.
statement.
And 49 other states have passed laws similar or more liberal than what Mississippi is looking at now. Isn't that correct?
I don't know the legislation on podiatrists in all of the
Okay.
states, but
If-
I have read a few qualifiers that states have not allowed, to her point, they had specific things that they did not
Okay.
allow. So right now, we're not restricting them with anything
Okay.
currently.
I think the bill addresses some of the concerns you raised. I mean, you talked about how not every, I guess, podiatric doctor has had the 3-year residency. There are some that less. So this says that they have to have 3 years accredited residency, graduate residency, and be certified to perform, I guess, RRA. And it has to be in a accredited medical facility. So there's other doctors there in case something would go wrong, which is bound to happen. I mean, things happen, I understand. So I think it addresses everything you've raised except for above the ankle and so forth. So to Senator Turner Ford's point, if this were to be amended and need to be amended to limit it, then that could be done. I think that could address all the concerns that you've raised. But I guess my last question is, if 49 other states have passed something similar or more liberal than Mississippi, and if the sky is going to fall as you kind of predicted, then why have not they repealed the laws in place? Why are they still in place? And why do we have to remain the only state that is the outlier compared to the other 49 who have had this on the books, some for many years?
Yeah, those are questions I'm not going to be able to answer because I don't know the legislature and all that. I'm an orthopedic surgeon that practices in Mississippi, and I take care of a lot of patients in Mississippi. But all I know is that the study that was mentioned earlier mentioned specifically that question has not been looked at very much. As far as should we allow that to continue to happen? And that was one of the reasons why they did that study, was to look at that specifically. Whether that's biased or not, I don't know, but that's what that study was designed to look at, was should we continue to do this? And their answer was the complication rate is higher. So if you're willing to accept a higher complication rate just to get more people in here working on people in Mississippi, then we should allow this bill to go through. If you're not willing to accept it, then we shouldn't. But I would not want this bill, particularly because of the specifics regarding that DPME 320, that specifically.
But if that were amended, then it would be acceptable. That's what it sounds like.
That's not what
So it's all or nothing
trying to
then.
portray, but
Okay.
that in particular is exceptionally unacceptable.
Okay. So what you're saying, in the meantime, somebody comes into Lucedale, George County, with an injury to their foot or ankle, they'll have to be they have to sit around. When you have someone perfectly capable of doing the surgery or the procedure, they have to be transported to Mobile or Hattiesburg, Gulfport, Biloxi, an hour and a half away, and waste valuable time in treating them.
Yeah, and I think you're probably talking about a very limited number of patients in that particular.
Well, not
group.
necessarily. You know, I know my area. I don't think it's greater than what you think.
But
And
to
I
get-
do appreciate you volunteering to come down now. I mean, we've been looking for 9 years. And then thank you for stepping up 9 years later and saying you'll do it. But I do appreciate that. You know, I think Dr. Georgian is one of the very few people have got the training that he has. And there's not many in this state. And to belittle what he has done, what his training has done, it's not only a disservice to him, it's disservice to his practice, and it's a disservice to my citizens of George County who are not getting the care that they need. Thank you. Thank you, Mr. Chairman.
Senator Hickman.
Thank you, Mr. Chairman. Just a couple of what I think are brief questions. I think I am, and I don't know about everybody else, but I am kind of unique in that I came in this room thinking I was one way on this issue. But really, I don't know where I am. And if we had to vote right now, I'd probably take a walk. But
And you know, he hasn't been here this long and is already figuring out he can take a walk. He's a quick learner.
So my question is, and we've talked about the training that podiatrists have to go through. Now, and I think you may mention to it too, and they may be better suited to answers, but there's a rotation that they go into after, or residency that they go into after they've done their postgraduate studies. My question is, are some of these people going to specific residency or training that specifically deals with surgery of the foot and the ankle? And I'm guessing this is kind of I don't know if it's a newer phenomenon. I don't know the first state to do this, but all states have caught on board. So are there specified training now for the type of surgery that we're contemplating in this bill?
So first of all, I'll answer your question, but I want to state that I'm sure Dr. Georgian is an excellent surgeon and an excellent person, and I don't want to demean that at all. Two, the only thing I can speak to regarding that is my orthopedic training was in San Antonio, Texas. And at the time when I was in training there was also a podiatry residency at that facility, the same facility that we had an orthopedic residency in. So that's my one perspective regarding what podiatry residencies are like. And at that residency, they did surgeries like in the foot only. They did not do ankle surgery. They did have a specialist that had come from Europe who did a special type of frame where they worked on the foot for Charcot foot problems like Dr. Georgian mentioned earlier. But that was that was a training he had specialized. So I know they have residency trainings where they're training under other podiatrists on doing podiatric surgery. In our residency program, they did not cross over, although they would try to do some orthopedic surgeries, and they would try to work up as high as they could, but that was essentially, they were limited to the foot and were not allowed to go to do ankle and above at that residency program.
Okay, and my final question is, I mean, do you think that there would be actual, I guess the question is, harm to the greater society if this legislation were to pass, not talking about individual harm in that, you know, certified doctors and orthopedics? I mean, I hate to say it in this room because some people take issue, but I'm an attorney by profession, and we see where people get injured by doctors of all profession. And so not individualized harm, but do you actually believe that if this legislation passed, there is a public health harm that we've done as this committee or as this body?
So none of us are perfect, and none of us have zero complication rate. If you look at the studies, even the orthopedic side didn't have a zero complication rate. So none of us have zero complications. That would not be the bar to be set. So there are good orthopedic surgeons and there's bad orthopedic surgeons. There's going to be good podiatrists and there's going to be bad podiatrists. So that we can't control, right? But what we do know is what we're doing is not getting rid of podiatrists. They're allowing them to do more, right? And right now we're allowing them to do all the way up to the knee. And I think the ankle procedures, and the higher you get, particularly in there, the more potential the serious complications happen. So if you have a complication with a big toe and you get infected, then you lose a part of your big toe if you have an amputation. If you have a infected or major complication with an ankle, then you lose your leg. So the level steps up. I don't go and, I see complications from local podiatrists and we take care of them. We see complications from local orthopedic surgeons, but I think based off of at least the evidence that I've seen, there is increased complications when podiatrists do the same surgery that orthopedic surgeons do as a whole. I personally think that's just a difference in the training and in the abilities. So I think there is a complication rate that if we allow them to do more, we're going to have to accept it, that complication rate is going to be higher. So yes, I do think there will be detrimental consequences by increasing the complication rate. And foot and ankle surgeons like me are going to be the ones that are going to have to try to salvage those problems. And it's easier to fix it on the front end than it is to salvage it.
Thank you, Dr. Burr. We appreciate very much your coming to talk with us today. And I think that in just a moment, I'm going to entertain a motion to rise and report. But I do want to say to the three people who came today, I know that each of you had other things to do. And I know this was very short notice. And we appreciate your coming today. This is a hectic time of the legislative session. That's just how it is. And lots of things are going on. But the number of senators who sat in this committee meeting and listened to what all of you had to say is an indication that we're taking all this seriously. And you have each done what I think we all needed for you to do, which is come give us your point of view and explain why you hold that point of view. So to the three of you, thank you very much. Obviously, we're not going to vote on this legislation today, but the hearing has been very useful. And now I'll entertain a motion to rise and report. All in favor say aye. All opposed no. The ayes have it. Thank you.